Good afternoon. Welcome to BCS, the Chartered Institute for IT. We have another very interesting webinar to look forward to today. As you will see on your screen, patient data and the importance of IT professionalism. There's obviously a lot to talk about here with the app just being trialed right now. I'll introduce the panelists shortly. Well, actually, let's do that now. Unfortunately, one of our panelists can't be with us on screen, so I'll just introduce Andrew first. Andrew Griffiths is formerly the director of NHS Wales, the Informatics service there. He's now the CEO of the Federation of Informatics Professionals. So welcome to you, Andrew.
Good morning, or afternoon even.
Afternoon. Then we have Professor Terry Young. He's from Brunel University, London, director of the Cumberland Initiative. Welcome, Terry.
Thank you.
And also Dr. Natalie Banner. Welcome, Natalie, who leads the Understanding Patient Data, an initiative by Wellcome. So that's interesting as well. Welcome, Natalie.
Thanks very much for the invitation.
So we'll have a chat in a minute about these subjects. I'd just like to do a little promo slide, if you'll just indulge me. BCS are having an ongoing campaign just to recognise what IT workers are doing right now. It's called the Vital IT Worker Campaign. You can see the hashtag there. We're looking at the contribution that IT people are making at the moment. Obviously, there's a contribution being made in difficult circumstances by many people, but our area is naturally IT professionals. So on LinkedIn, Twitter, Facebook and so on, you can nominate people that you think are doing a particularly useful or important job right now, and we want to recognise those folks. BCS's mission is to make IT good for society. We're seeing people working hard doing that right now in unusual circumstances, so I would encourage you please to do that if you can. So what I'm going to do now is just take the presentation off, and we'll just speak to our panelists. I'll stop showing the screen, and then we should just see all our. Oops. Good. So let's start our conversation, folks. We've got a few things that we can talk around. I'd just like to perhaps start off with the ethical considerations right now, because things are speeding up so quickly. The use of data, the pro arguments have come very much to the fore. Also, there's a lot of underlying unease. The history of data usage comes straight to mind. So I just wonder where you feel we are at the moment with those ethical considerations. Perhaps I can start with you, Natalie, on that one.
Thanks, Brian. And I think you're right. I mean, a lot of the issues that are emerging at the moment are not necessarily completely novel. That we have a sort of, long-standing history of exploring questions around ethical issues on data use, privacy and consent being uppermost. But of course, those are not the only ethical considerations to bear in mind, especially in relation to the development of new technologies, questions around equity of access, fairness, justice, those sorts of issues are also very, very prominent. So it feels as though particularly the current situation is really just exposing and bringing to the surface a whole set of ethical questions and considerations, but not necessarily anything completely novel from my view. We've been prepared to accept really significant limitations on our rights and freedoms recently. The way that we are making trade-offs about benefits and risks seems to have shifted, albeit perhaps temporarily, because we're accepting the fact that we might have to restrict our movement for some period of time in the context of the pandemic. But the way that we make those trade-offs and the way that the factors that we bring to bear on those, I think are really, really important to bear in mind, because it is changing. It might not be changing forever. We might go back to thinking the way that we used to think, but at least the very fact that the data is such an important part of this pandemic is forcing those conversations to be had in a more public domain, in a more public realm. And I think that's absolutely critical. I do think we've had a tendency to think about ethics as being a sort of slightly abstract, slightly academic topic that's for other people to think about, whereas the pandemic has really shown just how embedded and how practical some of these ethical questions and challenges are. And that's for everyone to consider. You don't have to be an ethicist or an ethical expert to weigh in and to have views views and perspectives on what the ethical use of data should be, and indeed where we might be crossing a line on whether and how and under what circumstances we might be using data collected about people.
So actually, Terry, you have that academic sort of angle. Can I take your sort of views on that point?
Well, Andrew and I had a quick chat about this yesterday, and I think it's worth maybe picking up Andrew's view first around the extent to which people are actually doing new things that are taking them into new territory, or the extent to which people are simply reinterpreting the rules a little bit. I think I follow a lot of what Natalie said. Maybe I can just hand over to Andrew for a second there, and then come back in. Andrew, what was your take on that?
Yeah, I think I'd agree with a lot of what's just been said. I think that data has come to the fore. I think that's a really good thing. We're seeing it on the news almost every night with graphs that previously would have been unexplainable are being explained to us in a reasonably coherent and useful way, and people are engaging with it because clearly we're in lockdown. It's having a major impact on our lives. So suddenly knowing what R is has become important to people in a way that you would never have considered before. So I think there's a lot of positives in just seeing the data on the news, people engaging with it and understanding that actually there's some impact on their day-to-day living. So I think that's a really positive thing. I think in conversation yesterday with Terry, not to have sort of done this conversation, but we were discussing, and I was really querying how much we're doing this different now to what we've always done. And in a sense, I think ethically, I wait to be challenged on this, but we're not doing anything different with the data that is outside of the rules or the bounds of what we've always done with the data. It's just possibly more visible, and people may be or may not be, I don't know, asking more questions about its use and what else we could do. I would say the challenge for us, that might stall out a little bit, would be, I think the question for us is more about, given that we've got all this data that we're now viewing every evening, there are issues about its accuracy, interpretation, and I think it's getting people into that, you think death data was a very easy thing, but actually it's not. And there's loads of complications about how it's collected, when it's collected, what people's interpretation, what the diagnosis on death was that the contributing diagnosis or the cause of death, it's all those kind of things that we know and love, the timing of that data coming in, where that data is collected. So again, in secondary care, we're used to that data being pretty available pretty quickly, but then there's the community deaths, and particularly relevant has been the deaths in care homes. And the question is, what processes do we have? And they're possibly not as timely or I don't want to cast aspersions, but possibly not as validated, I'll put it that way, as data coming from secondary care. So, I think there's a question there in my mind about, normally we have months of processing and looking at it before deciding that, yes, this data is okay to use. Now we're using it within 24 hours. And I'm not sure our systems are set up to do that forward-looking data use, so really being data-driven, rather than looking in, as they say, in the rear-view mirror and saying, oh, this is what did happen 6 months ago. We actually need that data now, that we operationally, as a country, to determine whether we continue to have a lockdown. So I think what it's doing is bringing the fact that data that we've always used has now become more vital as a future next steps to drive our behaviour, not just of the NHS, but as the country as a whole, economically and in every other way. So I think it's made some really quite simple data sets very visible. And I think it puts a challenge on us. How do we use that data more proactively? And I just contrast it, sorry to go on, I'll finish on this point. I contrast it with the use of someone like Tesco's data, where we know that Tesco's use their data. They know, within whatever it was, 2 days of us being in lockdown, they realised that people have stopped buying 25 different variations of baked beans. And we're more interested in flour and toilet rolls as it was. And suddenly they managed to get their supply chains to react to that. And we've seen a big shift in the stuff they've got on the shelves. And I think quite a remarkable shift when you think of it. And they're continuing to shift that because, believe it or not, the panic on toilet rolls is gone. And now they're slightly changing what people are buying, and people want to buy more in bulk because they're doing less frequent shopping, and they're reacting to that on the fly. And I think the NHS doesn't have that same capability to do that, and we need to develop that capability, I think. And I think that's a big challenge for us. And the last ethical challenge, if it is ethical, I'm not sure it is it's interesting that money can motivate a company to be reactive in its use or proactive in its use to data, and yet the health of the nation doesn't spur us on enough to use our data that we have got in the similar sort of way. I'll shut up at that point.
Thank you, Andrew. Terry.
So absolutely, no, I agree very much with what Andrew said. I think as a society we've become very used to saying we can't do that because it's against this rule or that rule. And I think what the crisis has done is it's forced people to challenge that and to think, well, actually, could I step up? Could I make a decision? Could I do something in this situation that needs to be done? And to that extent, I think that the interpretation of the rules is being stressed. I'm not sure that it's gone in a bad way. I think, when we look back, we'll probably pick up some examples where people went too far. And I think it'll be a question of sorting out what's happened well against what happened that we didn't want to happen again. And I think there'll be a certain amount of reflective analysis required. But I think on the whole, what's really come out of this is the need to act at speed and to use data for making operational decisions. And I thought that Andrew's comment about the difference between the supply chain to the local convenience store and the way in which we've seen numbers used on the news in other ways is really quite dramatic. And I think for me, what really interests me is getting the numbers right as far as making operational decisions around the country are concerned. And I don't think that the data has been perhaps as clear. There's lots of artifacts in it that are clearly to do with the way the data is being collected rather than reflective of the original data. So I would like, if we go into this sort of situation again, if we encounter it again in 3 or 4 years' time, I would like to see a lot better data out a lot faster, and to see us being able to mobilize and to work ahead of the pandemic so that we can race ahead of it and start to influence it rather than simply have to watch it evolve through a rather imperfect data lens. So for me, it's the operationalization of that data. And I think that this sort of moves back again to the sort of the patient data stuff. How much patient data can be used in an aggregated way safely, and then how much data is really affecting the individual's privacy. And I think that's a question that we haven't fully explored, and the two aspects are miles apart in my view in terms of what we want to do. And I think that's something that a group like the BCS could certainly help people to reflect on and to open up.
So
is that fair, Natalie?
Yeah, I think so. I think absolutely. Sorry, Brian, did you want to come in there?
No, carry on, Natalie. Fine.
No, I think you're absolutely right. I mean, one of the critical things here is to pick up on Andrew's point that the quality of the data and how it's collected and so on, it matters hugely. So, from the IT professional sector side, knowing and understanding, especially the limitations of that data, is incredibly important. We've seen so many examples of, wild, assertions being made on the basis of some data where it's inaccurate, it's flawed. We have to be very, very careful that in opening up and making more data available, which I think is a very important thing to do, there is that kind of context around it that sort of says, well, hang on, there might be things missing here, there's inadequacies here, we don't have, full representation in this way, that way, and actually, the role of the IT profession there, for me, feels very much like helping to shepherd that. So even if data is made more openly available and there's more of it, and it's and we can kind of more clearly base operational decisions on it, then the context around that and the limitations of that data, I think, also need to be articulated as well. And one thing I'm really interested in the longer term, when we do perhaps have a period of reflection, is kind of the role of public views and values in all of this. So, decisions are being made, data is being used in certain ways. Some of that is going to be fantastic, some of it might be less good. And perhaps if there is a period of reflection, we can actually sort of bring more participants in to say, well, did we make the right trade-offs here? And how can we learn for the future and build in some of those questions and concerns, rather than only ever look at this through a solely professional lens? So that, for me, I think will be a really interesting part of that sort of future reflection. when we get to that point, if we get to that point.
So we've discussed a couple of different types of data here already, haven't we? The sort of very profoundly personal patient data, which is very much about the individual. We talked about the kind of data that feeds into the national discussion of the progress of this pandemic. Now, I did warn you folks that we might have 15 minutes of questions and answers at the end, but what I'm actually going to do is feed the questions in as they come, because we've already had an interesting little comment here. So actually, for those that are listening in, please note the little questions tab on the GoToWebinar menu there. You can type your questions in there and we'll pass this on. So Eamon McNally's sent one in already. Given the amount of data we are already sharing with private sector companies, how relevant are the privacy concerns? So this is about personal individual data now. Perhaps I could bring Andrew in on that one. Perhaps we shouldn't be overly concerned because he shares so much already.
Yeah, I mean, it'd be interesting to have a bit more debate with the person who asked the question, but I tend to agree. I think that I'm not sure that during this current period that we are sharing any more data than we've always shared, and therefore there shouldn't be any concern, I would say. I'm not sure if the angle of that question is more about, hey, we're crazy because we're already sharing this data in a way that we shouldn't be doing it. So, now if that's the angle, then there's probably a different answer to the question. But I think that patient trust in how we use the data is vital. Maintaining that trust is vital. My own personal view is that all of the ways we currently share data that are correct, clearly there are some things that go on that are not correct, but that are within the legislation and the way that we do things, shouldn't cause anybody any concern. And in fact, most people would consider that we are sharing that data, and probably they think we're sharing it more than we currently are. And my experience of the problem of data sharing has not been that people are sharing too much, although clearly there are examples of that. And when it goes wrong big time, isn't it? That's the problem. But actually, the more of a problem is the aggregate of the small little bits of data that people are not sharing. And I would say that's probably more prevalent within healthcare settings, where individual clinicians might think that they cannot share data from secondary care to primary care, or they can't tell someone else a test result or whatever it may be. I think those things are working themselves out of the system. But I would say that in actual fact, the biggest problem we've got is not sharing data in the course of a patient's treatment, rather than we've gone wild and wacky and sharing it everywhere. However, having said that, trust is a big issue that we've got to be mindful of, and we've got to take the public with us, otherwise they won't share the data with us.
Well, actually, Eamon's come straight.
That was a bit of a ramble.
That's okay, no problem. Eamon's come straight back to me. In current circumstances, we would be crazy not to share data, given we know that contact tracing actually works. But perhaps I could bring Terry in on this point. Do you think that this current crisis has changed the public's perceptions of how we should use data? Perhaps it has broadened the conversation a little bit.
Yeah, wow, this is wild, isn't it? I suspect that we really need to think through the whole question of what privacy means in a sort of a data porous world like we live in now. And it strikes me that probably we got to gravitate towards a world where we actually have real privacy and it really is private, or we have like a neo village where everybody knows everything about everybody else. I'm not sure that attempts to try and draw lines in between those two will ultimately be that successful. I don't know. I think it's a really difficult problem, but it seems to me that thinking about what the extremes might be would probably help us to rethink what we want out of privacy and what we're able to deliver. The other question that you asked was about sorry, can you just rephrase that question, the bit at the end of your question? How should we, sorry, yes, I'm sorry. The question was, how should we then go on and use the data, and how much should be used about us? I think at the moment, the government would do better to try and create apps that involve us and involve us actively sharing stuff, rather than forcing us to share contacts with whoever we've been near. So I would like to see a system where we get everybody into sharing and participating in being the solution, rather than being observed as, where they've gone. So I would take a participative rather than an observational approach to that kind of data. But that would be my preference. I think the whole thing is a bit of a minefield. And at the moment, I think in many ways, we have the worst of both worlds. We have all the problems of trying to maintain privacy, and we also have all of the problems of our private details being lost to other people. So, you know, I think it's going to take a while to work that out, and I don't know what the solution is. I would try and draw people into sharing rather than trying to make a system in which they're manipulated or observed or automatic data is collected. But that would be my preference. I don't know that I know a good answer.
That's interesting. We've had a couple more questions come in. Then perhaps I could come over to you, Natalie. Nadia has sent a question in. What are your thoughts on data trusts?
Big topic. So first, I'll talk about data trust first, and then if I can comment on the previous question as well. So I think data trusts are an interesting idea. Essentially, the notion is that rather than data being collected about you and used in ways that you might not necessarily know, a trust is essentially a situation where you have a group of people who have a fiduciary responsibility to manage that data in ways that are that serve the interests of the participants. So it's a kind of a legal setup, a legal framework. There's lots and lots of different models of how you could set them up. The Open Data Institute is doing a lot of work on these at the moment. There's lots of potential of this idea of sort of data philanthropy, of people actively sort of donating or participating in some way. One of the big challenges of that is representativeness. You're only ever going to get the people who are the most engaged and active and involved and who have the capacity and the willingness to explore questions around, well, who should be getting hold of this data and how should it be managed and used. Is a lot of labor required on the part of the individual to care and to try and be informed enough to have a view as to how they want that data to be managed and used, so that their views and interests can kind of go into the decision making of that trust. So I think you have a real challenge, especially at a population level, of representativeness when it comes to questions around data trusts. To come back to the previous question, there is a lot of research that's been done on kind of public attitudes towards data use, and I think we have a fairly good grasp of kind of what the contours are of those sort of values and expectations. I don't think we yet know how COVID has changed those, but actually in early March, just before the world turned upside down, we released a report called The Foundations of Fairness, which was the result of an extensive public engagement exercise exploring what a fair partnership between the NHS and third parties should look like when it comes to sharing and using data. And we used citizens' juries, we explored lots and lots of different scenarios and kind of pulled different levers to see what it was people find acceptable and what they don't. And essentially, several things emerge from this, one of which is people get that the data needs to be used by third parties, whether that's academics, charities, or industry. And that's a range of companies ranging from kind of software analytics to business intelligence to pharmaceuticals and big tech companies. People understand that if there is a benefit that's coming back to the NHS, the healthcare system, and to patients, there could be really good reasons to allow this data to be used. But they're not involved at the moment, and they don't have a voice or a say. And so, the key things that emerge from this is, if there is an aim to improve care and health, then that is a positive thing. And all of those data sharing agreements and partnerships need to have that as the kind of fundamental core. There needs to be consistency in this, because at the moment it's incredibly fragmented. Although there are rules and regulations, people interpret them, as Terry said, in a slightly different way. So it's very, very hard to say from a system level, here's what the rules are. And so from a perspective of public confidence, that creates a big challenge. Greater degree of public accountability, governance, and transparency, just being clearer on the fact that this data is managed and used in these ways and what the benefits are that are supposed to be coming back. And finally, people really want to be involved in this. Once you start talking to them and exploring these questions around how data can be managed and used and who can use it and for what purposes, people actively want to be involved in that process. Even though data is quite a challenging topic to broach, because it can be technical, it can be quite dry, it can be quite abstract. Once you get into these questions around trade-offs and benefits and risks and so on, people want to be involved in that discussion and that kind of decision making. So I do think there's huge scope for a much more participative model, as Terry said, rather than it just being observational or extractive, to involve people and get them participating. That to me feels like a much a much more exciting way of thinking about data management and use. But then, of course, you still have the problem of representation of what happens to the people who are left behind, who aren't involved in these conversations. And that's something you absolutely have to factor in and think through very carefully. So, you know, pros and cons to that more participative approach, but certainly seems like it would be more productive and more trustworthy than a purely kind of observational model.
Is that paper on your Wellcome on the Wellcome website, Natalie?
It's on the Understanding Patient Data site. Yes, it's Foundations of Fairness.
Lovely,
Yep.
thank you very much.
Yep.
So this is a question I'm going to put through to you, Andrew, as CEO of the Federation of Informatics Professionals. This is one for you. Should we have global standards for the collection, collation, and processing of health data?
Well, that would be great. I think getting standards amongst ourselves is the first challenge. But yeah, I think there's a lot to be said for making sure that our data sets can be compared internationally, and indeed there's a lot of that goes on already to an extent. You know, and some great benefits that come from that. If you look at the World Health Organization and the European kind of that, a lot of data is shared, and actually I think the UK does quite well in providing some standardized data into that. And I think yeah, the OECD have commented that the UK is actually one of the better contributors in terms of the standards and the format of the data going in and the timeliness. I think that's clearly going to be helpful, and you know, this pandemic does show us, doesn't it, that there is well, you know, whether it's any use operationally, but we are comparing data internationally, and whilst we're not even sure that we're comparing the right data within the UK, I would question it even greater when you start to compare, you know, the death rates, etc., in Italy and Russia and China, dare I say it. And, you know, but certainly as a goal, is it a good thing to be able to compare that data and use that data in this kind of situation? Absolutely, yes. Yes, it is.
Well,
if I could,
sorry, go on.
Sorry, I was just going to comment on the last question as well, if I may, which is really about the public participation in the use of data. And I think, as I already said, I think trust is really, really important, and you can lose it so easily. I think one of the dangers with, not dangers, but one of the problem areas about involving people, as Natalie's already indicated, and I had some experience with this on a research database, is that when you bring some people in, they stop being the public and they start becoming more like the professionals. And the more they learn about the data and the nuances and the reasons why we do different things and why you've got to do things the way that you do, they, you know, in one sense, they become advocates for it, but they're then perceived as being on the inside, just like one of you guys, because we're all patients as well, so we understand some of those issues. And I think that's a real hard trick to pull off, which is where I would say that trust is probably more important. And, you know, rightly or wrongly, or for good or ill, I think that's where we need the politicians involved, because whether we like it or not, they have been elected. They are the representatives of the public. Whether we see them like that always is another matter. But we do need them on board. And I think we sometimes overlook the need to get cross-party politicians involved in some of this debate so that they understand it, because they are in the position to explain to the public the need for the data and can gain that trust, I think, whether we like it or lose it.
That sounds like a potential hashtag to me as well. We're all patients. That's a good little summing up. Thank you to Ian Robinson for just setting that question into us. Perhaps we could look at some of the ways that we might approach this data. So we've had a few interesting ideas floated. I'd just like to come to you on this, Terry. Things like using synthetic data sets, empowering people to run their own trials, or just democratizing data processing. Could you sort of give us a few comments on some more creative ways of approaching this problem?
I'm attracted to the idea of synthetic data sets, because I think one of the challenges is that the data that's out there, the ability of so many people to process it down and to identify you either individually or one as of a small cluster of people, really erodes your privacy, even if the original data has been highly anonymized or whatever. And one of the ideas that I like that I first heard about in, I think it was in a commercial context, was creating synthetic data sets which have the same characteristics. So you produce a model that will generate the same number of diabetics in a population, the same weight distributions, the same all kinds of distributions that mimic what's really going on in society, and then you do your testing and your analysis on those synthetic data sets, and that way nobody's privacy is up for grabs. And I think that there's a lot of merit in those kind of ideas. So that's a sort of a way of getting around some of the privacy challenges at a very sort of macro level. I think at a local level, if people understood the way in which they could articulate their needs in terms of building their own private case, maybe in very small clusters of people that share the same kinds of context or long-term condition or whatever, they might well find that with a little bit of training, they could start to articulate what they want in a way that persuades the payers or their local GPs or whatever to be able to tailor the response to them. So they might say, you know, we've run our own little trial, and they've got to be taught how to do that in a valid way. But the idea that people could run very small trials and come up with specific changes in the way that they wanted to be treated on the basis of that data, I think is potentially very powerful. It's not to do, but I think it would be really interesting to say how much more information do you have to give people so that they could run their own local trial, their limited trial within their own context, and that they could produce recommendations on the back of that and come up with the evidence that would furnish the cost effectiveness of their choices in such a way as to get more of what they wanted and to sacrifice stuff that they don't particularly want in exchange for what they do want. So I think that at the micro level, there's a lot could be done with data if people knew how to do it and how to collect data around themselves. And I think that at the macro level, there are different ways of creating data sets from which people could then do analysis, but without putting the privacy of other people at risk. Very vague ideas at the moment, but I think that they're quite interesting, and I think they'd be quite fun to start working with.
Do you have any thoughts on that, Natalie? Perhaps some more innovative ways of dealing with data in that way? It's interesting ideas that Terry's just talked about there.
Yeah, really interesting ideas, and I think you're absolutely right that ways in which the sort of the benefits of data use can be tangible is absolutely critical, because it often feels very, very abstract, very far removed from people's lives and experiences, and frankly what they care about. It's hard to know how and why to care about data when you don't really see or feel kind of the impact that it could have on your own life and the lives of the people that you care about. So I think innovative ways of exploring how individuals and how groups of people could be able to manage and use data themselves. We've got some really interesting examples like Patients Like Me kind of platforms where people are uploading information about their own care and their own symptoms and so on. Sometimes leading to kind of potential trials on off-label drug use, for example. There's some really interesting ideas there around enabling people to do more with data themselves. I think that's absolutely critical. So certainly finding ways to make data more relevant and more kind of in touch with people's own lives and what matters to them, I think is really important. So yeah, I kind of fully agree that finding some of those tools and some of those methods is really, really important. Can also help flag perhaps where we have really inadequate data, and I think that's something that needs to be sort of borne in mind as well. We talk a lot about privacy, but questions around representation and what's missing from data are really, really important. So who's missing from these data sets? What aspects are missing? Important aspects, I think as we're learning with COVID, things like ethnicity and the fact that we don't have good data on care homes. These are shocking things that we realize that there are big gaps in these data sets. So again, finding context and ways in which to, at a more local and regional level, get people interested in, engage with, possibly managing and innovating with data might also help flag where those gaps exist and possibly point towards some ways to help plug those gaps, because it feels as though there's an awful lot missing from data that we currently have.
That's interesting. Perhaps Andrew, could I bring you in here as well and just ask you about the balance in sort of trust and consent, because there's two extremes, aren't there? The app that's just being trialled right now is sort of a top-down thing. It's kind of being potentially just imposed, isn't it? On the other hand, there's things like dynamic consent, where people, enter into a dialogue about the information that they let go and what they don't, and that sort of thing. Do you think the public understand the balance there? Is that being upset by the current use of this contact tracing app?
I don't know. There's big questions there. I think the app is interesting because on one level, I can absolutely see the need for it, and you can see how people can accept the need for it because they can recognize it might be the key to them coming out of lockdown or breaking out from their homes. I think you could argue that although it's top down, and I must say at this point, I applaud the effort they've made to try and do something. Because very often we're very good at criticizing people, but actually it's pretty tough, hard yards, isn't it, when you're trying to come up with a solution.
Yeah.
So I applaud their efforts. I don't think they're about anything bad or sinister. I do. This is sure my trust. I do trust that the data will be used appropriately. I think there's the slippery slope argument, and I get all of that, but I think at the moment we're in the early stages of this. You could argue, though, and this is a question, I'm not sure these are well-formed thoughts, that it's the true democratization of the data, because people will, as I understand it, unless you know different, will have a choice about whether they download the app or not. And there's almost a sense in which the politicians will have to persuade us that we can trust them with the data. And then you will then download the app and participate. Now, the challenge with that, as ever with these conundrums, is that if only 5 people trust the government, then the app's no use whatsoever. No. You need quite a high percentage of people to be trusting for it to be useful. And so, you can see we could drift towards a position where the government say you have to download it, otherwise for the public good, for the nation's health, because without doing it, you are now you're blocking and causing a problem to the state. Now, if we get there, I think that's a real hard, difficult position to be in, and I think it would break all trust for a very, very long time if we got to that point. So in my little fantasy world, I would like to think that the government could convince 90% of the population to download the app. We all do it compliantly. It allows us to move on. And then after that, there is a removal of that app and the data, and we build the trust through this example rather than destroy the trust through this example.
Yeah, that's a good point, Natalie.
I don't know if that.
Yeah, no, I think that's a good point. Natalie, would you go along with that? That actually this is a golden opportunity to show that trust is the key element to making this sort of thing work.
Well, yeah, I mean, I think, Matthew Gould, who's CEO of NHS, when he gave evidence to the Science and Tech Committee the other week, said, look, we have to get the public to trust us, otherwise this isn't going to work. And I think that there's a risk of overemphasizing the sort of demand placed on people. You must trust us, you should trust us. Whereas we prefer to think of it as more, you need to build a trustworthy system. So create an environment which people have good reason to have confidence in, right? Because if you don't create that environment, then you're just demanding something of people, and that is not a way to kind of build over time and to build trust. You can't just expect people to trust you when you haven't demonstrated over a sustained period of time that there are good reasons that people should trust you. And the other factor of trust is, if at some point not everyone is going to be on board with this, and for whatever reason, if they feel disenfranchised by the system, if they feel like they've been treated unfairly in the past in other areas of public life, then they may have very good reasons for themselves not to trust this kind of system. So I think focusing on trustworthiness rather than trust is probably a good first step. And the other point I'd make is, what we must always bear in mind is who's missing from this conversation and who's missing from the ability to use that app. Certainly when discussion about the app was in the early stages, it felt very much like the app was going to be a sort of tech solution panacea, completely missing the fact that a huge proportion of particularly the most vulnerable people do not have smartphones and are not going to be able to have access to them and to this technology. So there was sort of gesture towards, oh yes, well, of course, we'll supplement it with manual contact tracing, but how are these things supposed to work together? And we don't actually know if this technology works yet, right? So this is all very experimental. And I think possibly a greater degree of honesty and openness about that would be would be helpful. I personally think that the kind of data management and so on is going to be pretty robust. They're going to be very, very careful about these sorts of things. But I don't necessarily think that the way that they've gone about the whole process, it's taken a long time to get, source code on GitHub, to have the data privacy impact assessment published. That in and of itself is not necessarily conducive towards people having trust. It's allowed that vacuum to be filled with concerns, misinformation, people raising all sorts of questions and concerns, and they just weren't on the front foot enough to address those. Now, I completely appreciate working under incredible pressure, and I think what they've managed to achieve in a short space of time is really impressive. But I think for all of these questions around sort of trust, it takes time, and you can't just expect it to appear magically. You have to demonstrate and show those behaviors, and show that you are trustworthy in order for people to have trust in you. And that's just something that's going to take a bit of time.
Thank you. Now we've had two very interesting related questions come in. First one from Kamal: do you think that trust could be established at a local level, local authority, primary care, and then moved out? And then another question from Nadia: how would you encourage collaboration between local authorities? There's a nice little link there. Terry, could I come to you on that one?
Well, I think one of the things that the whole IT world has done is it has reconfigured the local, national, the nearby, the distant equation in a completely different way. So distance is mediated in a completely different way online, if you like. As soon as you can connect up in real time, distance is a different sort of commodity. And I think that we're probably, I think this whole area is going to be about finding the right angle through which to view the problem, I think. And it's not always clear at this stage, because we tend to use the paradigms that we're used to, the local, the distant, and stuff like that. So it may be, for instance, that many communities which share a lot in common are geographically spread across, for instance, several of our major cities. I don't know, right? And you might want to find a way to bring them together using IT and to create a local solution with them. Coming back to Natalie's point, I think this whole representation issue, I don't think ultimately that there will be one solution which is demographically representative across the board. And I think what we're going to have to come up with is the idea that getting high levels of representativeness in one particular group of people may allow us to make progress in that front. And then we have to sit down and think about how we're going to fill in the gaps using perhaps completely different solutions. And I think that that's something that's going to be key to this. So I don't know what the answer is in terms of local and national. I think I suspect that one of the big challenges at the moment is we're talking about one R number that deals with the whole country. I don't think there is one R number. I suspect that in cities, the R number is massively different in terms of how quickly things are going to move than it is in other parts of the country. And I suspect that the R number that we're talking about is an average of lots and lots of different scenarios all over the place. And again, the IT solution may allow us to partition out some of those different things. So local might be a complete community outside a city, which all share the same sort of characteristics, although they're geographically spread a long way. And national might be all of the cities, although most of the people within range of each one might be within range of 10 miles of each other. And so I don't know the answer to your question, but I do think we need to try and find a way to conceptualize the problem in such a way that we're realizing that our old ideas about what's local and what's national, what's close and what's far away, are not necessarily the best way of looking at this. And one of my disappointments is that none of that sort of layering or sophistication or the sense that there's waves of things going on has really been reflected back either in the analysis that's been brought to the public or in terms of the policy that's been put together. If we could get a policy, even if it applies to mainly tech-savvy people, that deals with 50% of the country, I would say let's try and get that going and run with that, and then let's sit down and work out the other groups of people that are missed out of that, and let's get something together as quick as we can and fill in the gaps. So for me, it's a pragmatic exercise of trying to make stuff work and then trying to fill in the gaps. And I don't think that there's going to be a universal solution that's going to work well.
That makes sense. This has been a fascinating conversation. That is pretty much our 3/4 of an hour. Thanks so much for your input, folks. We very much appreciated it. I'm going to come back to you in a moment and just ask you how optimistic you are about how we're progressing. I'm going to ask, if I can, Andrew, as in your role as CEO of FEDIP, a shoot a fish in a barrel question, which is what is the role of professionalism amongst our health informatics professionals, just to establish that trust?
Yeah, I think we've got a huge role to play in that, and I think there's a big part here where, you know, comparatively we are a young profession, and we've got a bit of growing up to do, dare I say it, and I think that we have a role to play in making sure that people understand that the NHS can use the data safely and wisely, and understands security and hygiene. So I think the profession has got a big part to play in public trust.
Lovely, thank you.
Yeah.
Thank you. Natalie, you're optimistic about the way these things are moving at the moment, albeit quick.
Yes, no, I am. I am optimistic. I think that, you know, as you said, data has never been more prominent and more important than it is for managing this enormous public health crisis. And the very fact that we're able to have these conversations and people are raising these questions around trust and trustworthiness and how do we communicate, how do we get sort of better convergence from local to regional and across disciplines. It's so important these conversations are happening, and I'm really gratified that they are. So I'm optimistic that we can kind of capitalise on what is on a very unfortunate situation to ensure that how data is managed and used is kind of embedded in good, productive, responsible, ethical ways as we go forward. Yep.
Lovely, thank you. Terry?
I'm torn. I think it's great that people are having different sort of conversations. I think it's great that people are realizing that actually the data needs to be managed in a particular way, and it needs to have guardians or people that really understand data and can make it talk. I think that that's a fantastic thing to be happening. I think if the IT professionals can step up to that and can develop a sufficiently broad point of view, because you know it's massively cross-disciplinary, this agenda, I think it'll be a great success. I think the danger is that people are awakened to it. We make a little bit of progress, and then we sort of manage to inoculate ourselves against this virus of information, if you like, and we think, you know, we've just had enough, and we build up all our antibodies again and we suppress it the next time it comes around. And I think that there's evidence that that's happened quite a lot with quite a lot of innovation in the healthcare arena. So I hope that we really get the IT virus in a big way and the data virus in a big way, and that we actually move on to do things in a different way.
Thank you very much. Thank you for your concluding comment there as well. So Terry, Natalie, and Andrew, can I thank you so much for your participation? It's been fascinating. Can I thank the audience for their questions? I'm going to show my screen one last time, just so that you can see our next webinar, hopefully, if that's going to come up. It is. There it is. We're having a change of subjects. So this is next Wednesday, the 20th of May, cultural enrichment and staying social with IT. So we're looking at some of the contributions that IT makes to art, things like gaming, Second Lives can be discussed, all sorts of interesting bits and bobs that perhaps have flown under the radar somewhat. But for now, we'd like to thank our participants and our audience very much, and we'll bring this broadcast to an end. Thank you.